Listen-only mode.
Hello, this is Wayne Callan for Attitude Magazine, and welcome to the Attitude Experts webinar series. Today's topic will be valuable to many adults with ADHD, how cognitive behavioral therapy can help you better manage symptoms. We are very fortunate to have Dr. Andrew Gilbert, an adult and child psychiatrist and medical director of the Hallowell Center in New York City. He has been trained in cognitive behavioral therapy and uses it with patients with ADHD at the Hallowell Center. Dr. Gilbert will give some introductory remarks and then take your questions. If you want to ask a question, type it in the Ask the Question box at the right. So, welcome, Dr. Gilbert.
Thank you very much, Wayne. It's really a great pleasure to be here and to be a part of this webinar. And I want to thank Attitude Magazine for all of their amazing work in educating individuals about ADHD and promoting its education about it and diagnostic issues and treatment issues. And I want to thank everyone who's out there for tuning in today. It's a great privilege to be able to talk with you and to look forward to this. So ADHD is a neurodevelopmental disorder that often starts in childhood and is characterized by kind of an overarching deficit or problem with what we call inhibitory control. So that's our brain has this capacity to put the brakes on, and so individuals with ADHD have difficulty with that, and that can affect them in two major domains: cognitive, or problems with attention, problems with thoughts, executive tasks, organization, planning, time management, as well as motor or behavioral problems with impulsivity, problems with hyperactivity. And this condition can continue on into adulthood, and now we are much better recognizing its presence in adults, and we have some very effective tools that can help. And some of those tools include medications, but also therapies. And there are some evidence-based therapies now that have been proven to be very effective for ADHD. And that's what we're going to talk a bit about today. So the first thing I thought we'd do is just talk about the condition itself. And when I say ADHD, as many of you may already be familiar with, this includes ADD. This ADHD is the official diagnostic name for this condition, but there are different subtypes and or different expressions or presentations, which can be predominantly hyperactive, impulsive, can be predominantly inattentive, and can be combined. The treatment, cognitive behavioral therapy that I'm going to talk about today, and many of the other treatments can work for all of these presentations or symptom subtypes. So what is the CBT model of ADHD? Well, it starts with some of the core kind of neuropsychiatric impairments that I've talked about, predominantly problems with attention, problems with inhibition, and problems with self-regulation, which can often be characterized as impulsivity, which can be thoughts or behaviors. With a history of these impairments, often folks have struggled. Because, as I mentioned, this starts very early. So they may have a history of failing academically, interpersonally. There can be a history of underachievement. There can be a history of problems with relationships. They may also really struggle with some of these executive tasks as well, such as organizing, planning, managing, procrastinating, avoiding, and being easily distracted. So with ineffective or underutilized or with ineffective compensatory strategies, such as those that I mentioned, this can lead to impairment in school. It can lead to impairment in relationships, at work. The history of a sense of underachievement or failure can be associated with a lot of negative ways of thinking. Perfectionism, depression, anxiety, but a lot of negative self-talk. And that can lead to feeling very down, or feeling very anxious, or feeling angry, or feeling guilty. And taken together, these kind of mood disturbances brought on by these negative ways of thinking can impact upon these kind of limited compensatory strategies, executive tasks, and together they really can come together to make things especially difficult. So the cognitive behavioral model really targets all of these core impairments, intention, inhibition, self-regulation, by addressing some of the major areas, including distractions, organization, planning, developing skills in these areas, and then also what we call cognitive restructuring. So one thing that we've certainly learned about individuals with ADHD is that they can be a little bit less sensitive than others without the disorder to reinforcement. So part of treatment is trying to help individuals learn how to benefit from a bigger boost of reinforcement than what others may require. And that leads to the next strategy, which is learning to promote rewards during treatment. We all need rewards. We need to know that at the end of a hard day of work, we're going to go home and see the family, or go for a run, or go out with friends, or just relax. You know, that's our reward. Folks with ADHD may need a bigger reward, and it may need to be a little bit more frequent, or a lot more frequent than compared to others. So often what we teach folks to do is break down tasks so that they're smaller, a little bit more manageable, and that they're followed by these breaks and other rewards. It is so important to teach folks to foster a sense of accomplishment in their daily activities. And as Dr. Hallowell has written about in children, you know, it's important to foster a sense of mastery and a sense that I can accomplish these tasks despite this history of struggling. And you know, the bottom line is you're never too old for this. It starts early, but these are things that you can continue to learn to master and implement throughout your life. So by making things a little bit more manageable, and by adapting to folks with ADHD have, in my opinion, a lot of people's opinions, very kind of special brains. They're really wired. They're high performance. You can do a lot with your ADHD brain. It's not all negative. But if you can use the strengths that you have that you kind of come with, you can really gain a lot of confidence, and you can achieve the mastery. Since many adults have been struggling for many years with ADHD, they may have developed kind of unhelpful ways of thinking, and this can foster avoidance and procrastination, and this can undermine their success. So an important component of CBT is learning to better understand an individual's ways of thinking, how you think about things, and how that influences how you feel and how you behave. And people can learn to recognize and challenge and change unhelpful thoughts. And this is what we call cognitive restructuring. And this is really the bread and butter of cognitive behavioral therapy. And that's a big part of CBT for ADHD as well. You know, and finally, as I alluded to a little bit before, kind of jumped ahead there, it is so important to recognize and embrace all the wonderful qualities and strengths in individuals with ADHD. You know, all of these positive attributes, the high performance brains, the energy, the creativity, the dynamic personalities and temperaments and styles, these can all be overshadowed by all the negative stuff. You know, like, can't remember to do this, or I forget to do this, or it's so frustrating for me to organize and plan. And you know, it's so important as part of cognitive behavioral therapy to help individuals recognize those strengths and really emphasize them because there can be so much overemphasis on the deficits. Okay, I think that may cover the main slides.
Okay, good. There were plenty of questions. I thought we'd start with a general one about, can you give us an idea of how a CBT session is structured and what goes on during the hour or two between the patient and the therapist?
Sure. Great question. You know, it isn't cookie cutter. It really is going to depend on the individual and what the goals are and what we're trying to work on. That said, CBT is manualized, and so meaning that's helped us to study it, and so that we can study this type of therapy and say, yes, it is indeed effective. And there are certain ways of organizing CBT sessions that can be quite helpful. Indeed, you're really trying to teach individuals how to be more organized and how to plan. Usually, I will start with some basic education, and the first few sessions are dedicated to learning more about ADHD, learning about how it affects you, the particular target symptoms, and starting to work on ways to better organize and plan, and developing that skill set. So that a typical session like that could be writing down, completing an assessment form, and maybe an adult ADHD self-report scale, something along those lines, making sure that we are clear about what are the symptoms that you have and the severity of them, and then starting to consider how an individual might struggle with organization and planning, and developing some of the techniques and tools. So, for example, with organization and planning, we would often start with asking someone how they use a calendar, or how do they how do they schedule things, how do they plan, how do they organize their desk or their schoolwork, and then going through that and determining whether is it working for you, is it not working for you, and then coming up with some new strategies. It is very hands-on in many ways. It involves writing down, taking notes, learning how to take notes, learning how to use a notebook, learning how to use a calendar, and then giving homework assignments and saying, okay, for the next week, I want you to use this notebook. Put stuff in the notebook that we discussed, and then transfer into your calendar, and I want you to keep track of what that was like and how it went, and we'll go over next week. Often it can be once a week, it can be twice a week. It really depends on the individual's schedule and what's feasible. And there also can be groups. So Mary Salanto has a wonderful model for CBT for ADHD that includes both individual and groups. And we do the same at the Hallowell Center here. We have individual CBT therapists who do that work, and we also have them doing groups. So there are different models, but I guess I would say a typical session is in an individual setting is both the therapist and the patient client are sitting down with a pad of paper, and we're going through. We're doing a lot of writing and reviewing.
Okay. Several people have asked if it's necessary to be overseen by a professional, or is CBT something one can implement on one's own through books, materials, or just a helpful friend or relative. A lot of people have brought up that it can be expensive, it might not be covered by health insurance, so those are concerns of people who want to take advantage of CBT but might not be able to afford it. So is it possible to do outside of a formal psychiatric office?
Yeah, this is another great question, or several great questions. I think that to get started, it's often very helpful to have a guide, which would be a therapist, to at least start. I mean, you're probably going to start with some healthcare professional, some probably mental health care professional at the outset in order to clarify your diagnosis. And can it be done individually on your own without a guide? You know, this hasn't been studied, but it is possible. But I do strongly support working with a therapist, with a healthcare professional. There are manuals though that people can buy that can be helpful, and with some of my patients, if they already have kind of an understanding of what to do, feel like they really think they know, they just need a little bit of tweaking of some of their executive deficits, or using a manual can be helpful, but I strongly encourage folks to seek out a professional and get some guidance, because that's essentially what therapists are. I mean, we're coaches, we're guides. You know, we are holding hands. We're instructing. We're bouncing things around. We're the person to ask questions to, and so. Yeah, so I do recommend starting with a healthcare professional. But if you over time, the goal of CBT, as with all therapies, is that you learn how to do this independently, and a good therapist is going to be working with you on that. That's why you have homework assignments. So it really. Goal, it's important when going into this to know that this is not supposed to be something you are going to develop dependence upon the therapist. You're going to maybe at first, but then one of the major goals is to develop a sense of independence. That I can do this on my own. But predominantly, I would say, yeah, I think I would recommend working with a healthcare professional first.
Okay. One area that maybe I should have started with is how valuable a tool CBT is in terms, I mean, there have been a fair number of studies, and its effectiveness is pretty well documented. So I was hoping you could at least mention a few studies, or just talk about the research in general before we go on to more specific questions about how key CBT can be to ADHD symptom management.
Yeah, okay, sure. Well, this has been studied in adults, and more recently it also has been studied in adolescents. And in adults, it can I mean, there have been studies by Salanto and trying to think of well, I apologize. Ramsey has also done quite a bit of work in this, Rothstein. About across a lot of these studies, it seems that almost maybe up to 65 to 70% of patients were rated by their clinicians as very much improved in ADHD symptom severity after going through a CBT treatment, and so we're talking pretty impressive numbers, in the 60%. There have been studies where it's been higher than that, and the in adolescents, there was a study. Was that in just about? It was reported about a year ago, suggesting that that a model for adolescents could be adapted that also can show really substantial symptom improvement. So.
Okay. One participant writes in, since my distractibility is very high, how do I maintain my positive thoughts over the long term? Can you give me specific ways to do that?
So, there are several things that can help with reducing distractions, and I'm not sure what this individual's particular distractions are. So, if they, in therapy is we'll have you do kind of we'll check how long you can pay attention for. We'll have you sit down in the session and then practice this at home, and even with a stopwatch, kind of see how long you can go before you get distracted, and then have you kind of write down your distractions, and then but not listen to them and not follow them. Just write them down and go on, and then at the end of the end of that task, have you carry out a task, go back and look at those distractions, and you can learn a lot from this, because as I mentioned, distractions, well, folks with ADHD can also have depression, can also have anxiety, and so worry thoughts or ruminations, negative ways of thinking, can be quite distracting, on top of just big, creative, dynamic ideas that a lot of folks with ADHD have. Some of my patients say they really have, they're not necessarily generating strong emotions while they're distracted, and they're just drawn to other things that seem to be of more interest, or things that come to them. And then others describe more emotions. They're working and they're getting bored, but they're also feeling worried and anxious, and a lot of thoughts are coming into their mind. And so, from a cognitive behavioral therapy approach, we would have you write this down and really explore what are those distractions, and really kind of meet them head on. And if they're worry thoughts, we would want you to to consider whether they are accurate or whether they're a bit distorted. Folks with anxiety or with depression can have different ways of thinking that aren't particularly helpful. They can have automatic negative thoughts. They can have all or nothing thoughts. They can jump to conclusions and predict that negative things are going to happen, or they know what someone else is thinking. They can really magnify the negative side of things and minimize the positive. They can do a lot of labeling, negative labeling, mislabeling things. So if this is going on, then part of the therapy and one of the strategies that we would work on would be to have you challenge those thoughts and, in a sense, kind of put those thoughts on trial and say, well, are these accurate? Are these fair? Or are these potentially distorted? And if so, maybe I can think about things a little bit differently and change those thoughts. And in so doing, that might reduce the anxiety or the depression or the anger that's being triggered. If you do this over time, what seems to happen is that those intrusive thoughts and negative thoughts can dissipate quite a bit. I mean, this takes time. People have developed these patterns of thinking for a long time, and so changing them can take a little bit of time. But that's one way of addressing some of the distracting thoughts. If they're big ideas that are distracting, and you also are going, when writing them down, you're going to look at them afterwards and say, well, is this really a topic or an area of importance right now? Do I need to deal with this now? Is this at the top of my to-do list? And if is this something of really high importance, less importance, lower importance? And by doing that, knowledge is power, and being more aware of how you're thinking about things can really help you control things better. Not only can it help you change how you feel, and I don't think I did a good enough review earlier about the relationship between thoughts and feelings. That's part of the CBT model, but I can go back to that. But you can not only change by being more aware of how you're thinking, you can really be more in control of not only the thoughts you're having and the distracting thoughts, but also the feelings you're having and the distracting feelings. But and then there are behavioral changes. Part of cognitive behavioral therapy is also learning strategies to reduce, look at your desk, and we explore how you set up your filing system, how you set up your desk, what's the situation like in your work environment or school environment. And there are some adaptations you can make there that can really minimize the distractions, and that can go a long way. I think the individual's question was about hope for because there's such a high level of distractions.
Yes.
Yeah, and my view is that this is a big part of what CBT is about, which is helping you to reduce those distractions, and there are many things that can help. And so I think people can be very hopeful and optimistic that they can reduce those distractions. And many patients have said that they're concerned that if they do see their level of creativity and how spontaneous they can be, and how they have these great ideas, and often are concerned that that any kind of treatment, not even meds, even therapy, is going to somehow take away their creativity or their spontaneity. And I really don't see that. I mean, I think people, for the most part, what most people experience is that the more that they are able to control their thoughts, control their feelings, reduce the distractions, the better that they are, the better control they have over their life in general, and they can be quite, it leaves plenty of room for creativity. So, yeah, go ahead.
Yeah. Do many of your patients take medication while doing CBT? Is this type of multimodal approach more effective than just taking medication or just doing CBT?
Both can work. It really, there are so many individual differences, and so the combination can be quite effective for some individuals, and it really depends in many ways on the level of severity. I have patients who CBT alone is enough, and just making some changes with some other changes in their life, improving their sleep, increasing exercise, changing their diet, getting them out there to be more socially engaged, and some of that is going to come through the CBT. The therapy, is going to help you to achieve those goals. That alone can do it, and yet there are others where it's the distractibility often, or the anxiety, or the all of the, it really can be any of the features of ADHD, but particularly the more the cognitive, the inattentive subtypes features, that is just substantial enough that it's just hard to sit and really immerse and in the therapy. And so that's where a medicine can help and can enhance things. The goal is never long-term use, long-time use, lifetime use of these medications. I really view them as tools, and short-term with the goal of, at this window of time in your life now, this could really be an effective tool to help you learn some new skills. But we're always going to be checking to see how you're doing with the medicine, if there are side effects, or and with symptom improvement, that's a sign to any doctor, and certainly in psychiatry and treating ADHD and other conditions. Symptom improvement is the sign. Let's see how things go off the medicine. Let's try a break and see how you do. But it really is variable. If you see enough patients, you find that there are, despite what the research shows, which is a group analysis, which is so important, but each individual patient is unique, and you really have to tailor the treatment to their particular needs.
Mm-hmm. Mm-hmm. Another woman asks, as an ADHDer, it is overwhelming trying to pick practitioners and try them out. It is expensive and time-consuming. Can you give us an idea of where we can look for practitioners that are reliable and solid? This person happens to live in Chicago, but how does one go about doing that?
Yeah, I think that can be challenging for a lot of folks. The same applies to finding any doctor, or how do you find a pediatrician that you like? How do you find an internist, a general practitioner, an OBGYN? And when it gets to psychiatric disorders, mental health, and the potential stigma and people's discomfort with sharing with family members and friends, who often are sources of referrals, it can be challenging. I think, fortunately, the stigma is changing a bit, quite a bit actually. But folks may not be so comfortable asking a friend or a family member for the name of a good psychiatrist. So I think that magazines like Attitude and ADDitude, I think that Attitude magazine is a great resource. I think CHAD is a great resource. The American Academy of Child and Adolescent Psychiatry, the American Psychiatric Association, these are reliable websites where they can...
I can't hear him now.
Oh. Hello?
Yeah.
Can you hear me?
Yes.
Oh, I apologize.
That's okay.
So going to reliable websites, and our center in New York, the Hallowell Center, we have a site in New York. We also are in the Boston area and now in San Francisco, and a website that's very user-friendly easy to access. We can be a resource for finding practitioners close to home. We have colleagues who are around the country and around the world who we can try to connect you with. I think you could reach out to your primary care physicians who may also know of specialists who they would recommend. But it can be challenging, and fortunately, some of the resources I mentioned though can help. I don't know if this individual has tried any of that and had any success or not, or there were some bumps in the road. But I would say keep trying.
I think she wanted to know if there was a clearinghouse of CBT therapists. Would somebody be able to Google that, or I guess?
Yeah, I think yes. There is a well. There is a. If you do Google, if you do Google CBT for ADHD, you should be able to find a list of folks who are trained, or at least some resources out there.
Okay, that's very good. How does CBT differ from talk therapy? I mean, are there any similarities, or are they just completely different disciplines?
So CBT is a form of talk therapy. I mean, talk therapy means that you're doing some talking, like with your therapist. Essentially, that's what it is. You're reaching out to someone who is trained in helping you to better understand yourself and how you think, how you feel, how you behave, and that's essentially what a therapist is. But there are different models and different approaches and different paradigms. But CBT is really a talk therapy. It's a type of talk therapy, and it's, as I mentioned earlier, it is manualized, or it's highly structured. So there are protocols that are followed, and that I had outlined a bit earlier, but which are the model is predominantly working on organization and planning, and then working on how to reduce distractions, and then doing the cognitive restructuring, kind of exploring how your feelings are really driven by how you think about things. So having a lot of negative thoughts can really affect your mood, making it anxious, angry, irritable, depressed, and that in turn affects how you behave. And so there are specific and kind of standard kind of approaches to this that are used in the cognitive behavioral therapy model, but it does overlap with other therapies quite a bit, and it's really just teaching you to better understand how you think and how you feel and how you behave, and so it is a talk therapy. It is distinct but yet overlapping with other talk. It is distinct from but overlapping with other talk therapies. If that's helpful, I'm not sure.
Okay. Yes, that's helpful. Could you possibly give us how CBT would help with a case of low self-esteem? There are a lot of people who are with us today who are asking about exactly how you would approach, how a session might go with a person who has low self-esteem.
Yeah, and that, unfortunately, that is not unique to folks with ADHD or ADD. As I had mentioned in the introduction, having a history of failing at things or struggling with things or underachievement or being told that you're not achieving on a level that you should be performing at, or getting in trouble in school because you're either, quote unquote disruptive when it's just hard to put the brakes on, or you're talking in class or interrupting because you just, again, it's hard to put the brakes on. So many kids, can be viewed as being disruptive or oppositional, and really they just are just, it's hard to sit, it's hard not to talk, it's hard to inhibit themselves, that inhibition deficit. And that can lead to academic and friendship, relationship problems. And so that can really chip away at individual self-esteem. So what you work on in therapy is, you attack this at many levels. All of the approaches can be helpful, because what you're trying to do is really change how you're behaving and how you're thinking. And so so I'm going to try to be more specific. It's going to depend on that individual, but if someone is feeling really hard on themselves, you are going to work on, you're going to talk about, well, what are you thinking about? What are the thoughts that come to mind? And you actually, so part of this cognitive restructuring is literally kind of mapping out your, we call them thought recordings, but you're actually going to record the actual thoughts that you're having. So I'll never be good at this, or I'll never be able to be as successful as I should be. You may recognize a lot of should statements, or if it's very all or nothing thinking, very black and white statements. It's all bad, or I'm all, and the therapist is going to help you to recognize that. You maybe have been thinking like this for some time, but never known that you were thinking like this. And it's really remarkable, because once folks start to, hear this, it just can take a few sessions. There's one session where an individual says, "Wow, you know what? So that's what I've been doing. I've been like, yeah, I mind read all the time. I'm always assuming I know what that person at work is thinking, and they look at me a certain way, and then I assume I know that it's that they don't like the way I've, they don't like the way I performed, or what I said, or how I look." And once you start to recognize it's patterns of thinking, and you realize that they're really having a huge impact on how you feel, you then can control things. You can change those thoughts. You can say, well, wait, that's not really accurate. That's, in some cases things are all or nothing, but usually not. Most things are not so black and white. Or, another way of thinking is catastrophic thinking. So if I don't, if I don't do this, or if this doesn't work out, something terrible is going to happen. And that, in a true catastrophe, yeah, indeed, you're going to be really afraid and scared, but a lot of folks have catastrophic thinking in response to things that really aren't on that level. And when you explore this, you almost kind of put these thoughts on trial. You find that, wow, I'm not really being fair to myself. I'm really not, I'm not treating myself the way I should be treated. I deserve to think about things a little bit different, or very differently. Those thoughts are just not fair. They're distorted at the mirrors at the that are really short. We can distort the way we think about things, and really exaggerate these thoughts, and they can make us experience kind of exaggerated emotions. And so that a lot of folks can I often use sports analogies, but with a lot of patients, it's really like looking at game film. You're kind of going back over over an experience that you had and trying, and almost like you're looking at things in slow motion. How did it evolve? And the therapist is going to engage in what can be kind of an annoying, but it's not meant to annoy, but a repetitive question called Socratic questioning. So you're questioning. So then, what do you think about that? And what is that? And what does that mean? And so what does that mean? And by doing that, you really are forcing yourself to really kind of dig down deep into a lot of the thoughts that you have that you're not always conscious of. And by becoming more conscious of them, more aware of them, you can control them. And you can say, well, you know what, things are grayer than that. I'm not, the reality is that I have had some success in certain things, or people do like me, or this isn't, the reality is that I'm not going through right now the same thing I've went through when I was much younger, and I felt very ashamed, about something. Maybe I was in class and I felt put on the spot, and it was very embarrassing. That those kinds of experiences can stay with people, and they can affect your thinking. So we're challenging those, and those can really impact on your self-esteem.
Okay. One last question. For a person who's diagnosed with ADHD and depression or anxiety, a comorbid condition, can cognitive behavioral therapy help one, both, everything?
Yes, absolutely. It can help. So folks who are trained in cognitive behavioral therapy for ADHD will have a background in cognitive behavioral therapy for depression and anxiety. And as I mentioned, this really is the kind of the bread and butter of and the cutting edge of treating depression and anxiety. And so absolutely, this is a very, very thorough treatment and effective treatment for both ADHD alone, but certainly, the majority of ADHD runs with other conditions, and there is high comorbidity with things like anxiety and depression. So this can really be quite effective for the combination or the individual disorders.
With the approach, would you tease out the depression and deal with that, and then also
Yes.
and then would there be a parallel track where you'd be dealing with the ADHD symptoms?
Yeah, and this is such a great point. I'm glad this came up, because this is why I was saying that each, the model is really tailored to that individual and their needs. There are these kind of core approaches, and domains, the working on executive stuff and working on cognitive restructuring. But that individual who you're working with, maybe their depression, which may, is their depression really driven by their ADHD, or is it also separate? Do they have depression with or without the ADHD? And a psychiatrist or psychologist will be able to help you determine that, and then it's going to depend on how severe things are, and you're going to start with really what's at the top of the list, the priority list. If someone may have ADHD and really struggle with distractions and with their executive skills, but they're very, very depressed right now, that's going to be important to really spend a lot of time on the depression and maybe make that a top priority. Again, though, a lot of the features of the treatment are going to work, but maybe more of an emphasis on the cognitive restructuring and other behavioral techniques. I should point out there are also part of cognitive behavioral therapy is also learning some ways to help you to manage stress and learn to do some breathing and actually take advantage of distraction. Distraction isn't all bad. It can be helpful. So there may be times when distracting yourself can really help to alleviate some of the strong emotions you're having that are interfering. So, and if someone is really, really anxious and also has ADHD, it may be really important to focus on the anxiety and some behavioral techniques to address that first so that they can then control their anxiety better and then really immerse in the other skills that we'd be working on.
Okay. Here's a typical ADHD question, and we'll end it after this. I am a miserable failure at formal CBT. I hate being told what to do, even by myself. And I instantly get on my guard when I meet with a therapist. How can I take advantage of CBT in my life to manage symptoms?
Well, so a couple of things come to mind. Therapy is hard work, really is. Therapy is not easy. That doesn't mean it has to be torture. It shouldn't be. It doesn't mean it has to be too painful. It should not elicit suffering. But therapy involves facing things that are challenging and are difficult to face and elicits discomfort. And actually part of any therapy is going to be helping an individual tolerate discomfort and tolerate change. And so it is important getting a sense of what your expectations are going into therapy. You know, and certainly it sounds like in this case, you know, now it's that it's going to be a failure. But you may want to explore that. So maybe this is an example of doing some CBT on your own. You can explore some of these thoughts you're having, and are they accurate? Are they fair? Is it all or nothing? Is this kind of a catastrophic thought about therapy or CBT? Do you really have enough evidence that this it's not going to work, it's never going to work? And maybe it's a little bit grayer than that. Maybe there were some positive things that came out of it. Maybe there was some progress, but it just, and listen, I understand it's not easy. It is frustrating. It is, I'm not saying it should be easy, you know, at all. I mean, it's really hard work. I am so proud of, and I have such respect for folks who are facing their problems and facing their challenges and trying to make change. It's just, you know, these are heroes to me. I mean, it's a privilege and honor to work with folks and really try to be their coach and, you know, see them grow. And so, listen, but maybe maybe reassessing some of the thoughts that you have about your past experiences could be helpful. You know, connecting with the therapist is also very important, and sometimes it can take a little bit of time to make that connection, and or find someone who you really feel comfortable with and connected with. I don't advocate bouncing, you know, giving it not enough time, and that can be hard with ADHD because people can be very impatient and really want to move on. It's uncomfortable. I'm bored. I got to move on. But trying to hang in there with someone, and you know, you may find that maybe you're by learning to tolerate someone else, you can better tolerate some of your own struggles. But I think that CBT can absolutely work for really anybody. Absolutely. It's but you know, it's got to be tailored to your individual strengths and your needs, and so I would love to be able to talk more with that individual and really hear more about their story, but I hope that was helpful.
Yes. We'll have to end it there. Thank you very much, Dr. Gilbert, for such an informative webinar. And please tune in, everyone, into our next webinar on Jan 16th. Sari Solden will talk about how to learn to accept and value ADHD differences. So have a good day, everyone.